All right, I am Dr. Greer, board certified plastic surgeon in Cleveland, Ohio. Today I want to talk about lash serums, and just so you can see, these are not my eyelashes. I've been using a lash serum, either Latisse or Revitalash, for something like 10 years now. I've actually got to see how short my own eyelashes were when I stopped using it while pregnant, and I definitely prefer it with the lash serum. So there's something people use really commonly. They're also something that can have side effects, and I have people ask about that a lot. So I just wanted to cover that topic today. The only prescription lash serum on the market is Latisse, which is sold by Allergan, and it is bimatoprost, which is a prostaglandin. And it is also sold under the name Lumigan as an eye drop for glaucoma, which is an issue where you have increased pressure in the eye itself. And the way it was discovered is these glaucoma patients who were using Lumigan as an eye drop had these really lush, long eyelashes. So, of course, the company figured this out and then marketed it as an FDA-approved eyelash serum. And the way it's used, you put a little dropper on a brush, swipe it along the upper lashes once a day. And it works by increasing the hair phase where the hair is actively growing. So in the cycles, or in the phases of the hair growth cycle, anagen is where it's actively growing, and increasing the anagen phase means that lash gets longer. It also makes them a little darker and thicker, although we don't really know how that works. And the effects only last as long as you're using it. If you stop using it, they'll gradually regress back to your normal eyelashes. When used as an eye drop, there have been some reports of the iris darkening, and that is permanent. I've never seen it when used topically, and I think that's because the medication is actually not going into your eye at all. So that's not a side effect I personally worry about. I have light blue-green eyes, and I have not noticed any darkening in 10 years. You may also see some darkening of the lash line where you put the Latisse, and that is temporary and goes away. Some people do have eye irritation with Latisse or with other brands of lash serums. If that happens, I recommend definitely try another brand. I know someone who had a lot of irritation with Carepros, which is also bimatoprost, but it must have been in a different preservative or different carrier fluid that irritated her, and Latisse was fine. There are a couple other options on the market. Carepros is still prescription, as is Latisse. It's just made by a different company. And then there's Revitalash, which is made by Galderma. That one is non-prescription, and we have been carrying it in my office. It's another prostaglandin, so it's just a lower concentration. A lot of medications, like the prescription version, is just a higher strength than the over-the-counter version. And I actually like it because I feel like it darkens my lash line a little bit less. It can take a little bit longer to see an effect, so like maybe 6 weeks instead of 4 weeks, but the end result is the same. And what I really love about Revitalash, with Latisse, you have a dropper bottle and all these little brushes. And so you have to open up the brush, put the drop on the brush, and the brush soaks up a lot. So I feel like a lot of medication is wasted. The Revitalash comes in what looks like a liquid lash liner bottle. So you just unscrew the top, the brush is there, swipe it on. It's much, much easier. They also have a formulation with like a little foam brush that you can use on your eyebrows, which is nice because, they get kind of patchy and sparse as we age. So Revitalash and Latisse are the two main ones on the market. I think Rodan & Fields also has a lash serum, which has a different prostaglandin. If it's got a prostaglandin in it, it's probably going to be effective. So I can't comment on the Rodan & Fields specifically, but I know Revitalash definitely works as well as Latisse. Long term, generally no side effects and well tolerated. If you obviously are having irritation due to the medication, you should stop it. And if you have uveitis, which is where there's an inflammation in the eye, or you have glaucoma, which is increased pressure in the eye, definitely talk to your ophthalmologist before using either Revitalash or Latisse, because you don't want to double up on medications or use something that's going to cause vision problems. They're not recommended in pregnancy. And that's really largely because they haven't been studied. So, and that's common with most medications. We don't study them on pregnant patients unless there's a really big benefit to taking them. Like antidepressants, we study, obviously, because it's important to continue antidepressants if possible. That said, I think because Revitalash is over the counter, it's not necessarily contraindicated in pregnancy. I usually tell people to stop it in pregnancy, but breastfeeding is fine because even if it's absorbed, it's in tiny concentrations, if it's excreted in breast milk and taking it orally, there aren't side effects. So I personally used Latisse, I think, while pregnant and breastfeeding. I usually tell my patients breastfeeding is okay. Pregnancy, I would probably hold off. And that's just because we don't know. The products usually cost around $150 for like a 3 to 6 month supply, depending on the bottle size. I mean, again, with Latisse, the brushes soak up a lot. I know with the Revitalash, the larger size tube has lasted me 6 months. And you can get them at a lot of plastic surgeons' offices or dermatologist offices. You know, we usually carry one brand or the other. They're nice products. They really do work. I love them, especially during the summer when I don't want to wear mascara because I'm sweaty or we're in the pool and it gets all smudgy. So they're a nice option. If you have any questions about Latisse or Revitalash, leave them in the comments. Be sure to hit follow so you catch future videos and so you see any answers I may leave you. Have a great day, guys.